What is bladder cancer? Bladder cancer is a type of cancer that begins in the cells lining the bladder, the organ responsible for storing urine. It is the sixth most common cancer in the United States, with several subtypes, the most common being urothelial carcinoma, transitional cell carcinoma. Bladder cancer can range from non-invasive, confined to the inner lining of the bladder, to invasive, extending into deeper layers of the bladder or beyond. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Standard of care treatments for bladder cancer. The standard of care treatments for bladder cancer depends on the stage, grade, and type of cancer. Common treatment options include transurethral resection of bladder tumor, TURBT. For non-invasive bladder cancer, small tumors can be removed through a cystoscope. This is often done for both diagnosis and initial treatment. Intravesical therapy. After TURBT, intravesical therapy may be administered directly into the bladder. Bacillus Calmette-Guérin, BCG, or chemotherapy drugs like mitomycin C are used to prevent tumor recurrence. Partial or radical cystectomy. In cases of invasive bladder cancer, a portion of the bladder, partial cystectomy, or the entire bladder, radical cystectomy, may be surgically removed. In radical cystectomy, the surgeon may create a urinary diversion to reroute urine. Chemotherapy. Systemic chemotherapy, which involves the use of drugs that circulate throughout the body, may be recommended for advanced or metastatic bladder cancer. Immunotherapy. Immune checkpoint inhibitors, such as pembrolizumab, also known as Keytruda, and atezolizumab, are approved for the treatment of advanced bladder cancer. They work by enhancing the immune system's ability to fight cancer cells. Radiation therapy. Radiation therapy may be used in conjunction with surgery or as a primary treatment for bladder cancer in select cases. Seriousness compared to other cancers. Bladder cancer is considered serious due to its potential to recur and progress. However, its seriousness compared to other cancers depends on various factors, including the stage at diagnosis and the subtype of bladder cancer. In some cases, bladder cancer can be non-invasive and highly treatable, while advanced or metastatic bladder cancer can have a poorer prognosis. Prognosis for stage 1 bladder cancer. Stage 1 bladder cancer is confined to the inner lining of the bladder. The prognosis for stage 1 bladder cancer is generally favorable, with a high likelihood of cure. The 5-year survival rate for stage 1 bladder cancer is often greater than 88%, especially if the tumor is low-grade and well-differentiated. Prognosis for stage 4 bladder cancer. Stage 4 bladder cancer indicates that the cancer has spread to distant organs or tissues, such as the liver, lungs, or bones. The prognosis for stage 4 bladder cancer is less favorable, with a lower 5-year survival rate, typically ranging from 5% to 15%. Treatment aims to manage symptoms, slow disease progression, and improve quality of life. Promising therapeutics for bladder cancer. Ongoing research is exploring promising therapeutics for bladder cancer. Some areas of interest include targeted therapies. Research is ongoing to identify and target specific genetic mutations and molecular pathways involved in bladder cancer growth. Drugs like erdafitinib have been approved for certain genetic subtypes of bladder cancer. Immunotherapy approaches are continuously being studied to enhance their effectiveness and expand treatment options for bladder cancer. Combination therapies. Researchers are investigating the use of combination therapies, such as combining immunotherapy with chemotherapy or other targeted agents to improve outcomes. One promising integrative treatment for bladder cancer is hyperthermia, the use of high levels of heat. This is described in greater detail in Cancer Self-Defense 101, Quick Tips to Help You Survive. A website to research promising clinical trials for bladder cancer is onclive.com. Why is bladder cancer tricky? Bladder cancer presents several challenges, making it a tricky type of cancer to manage. Recurrence. Bladder cancer has a high likelihood of recurrence even after initial treatment. Patients often require long-term surveillance and follow-up care. Multiple subtypes. Bladder cancer has various subtypes, each with different characteristics and responses to treatment. Tailoring treatment to the specific subtype is essential. Limited symptoms. In its early stages, bladder cancer may not cause noticeable symptoms, leading to delayed diagnosis. Symptoms like blood in the urine, urinary frequency, and pain often appear later. Metastasis. When bladder cancer reaches an advanced stage and metastasizes, it can become more difficult to treat and manage. List of FDA-approved medications for bladder cancer. Several FDA-approved medications are used in the treatment of bladder cancer, including immunotherapies, pembrolizumab, Keytruda, atezolizumab, Tecentriq, nivolumab, Opdivo, durvalumab, Imfinzi. Chemotherapy, gemcitabine, Gemzar, cisplatin, carboplatin, paclitaxel, Taxol. Targeted therapy, erdafitinib, Balversa, approved for certain FGFR genetic alterations. BCG's use in bladder cancer, Bacillus Calmette-Guerin, BCG, is a type of immunotherapy used in the treatment of non-invasive bladder cancer, particularly in cases of high-grade superficial bladder cancer. BCG therapy involves the use of a weakened form of the bacteria Mycobacterium bovis to stimulate the body's immune response and help prevent the recurrence of bladder cancer. BCG treatment is typically administered as a series of intravesical, inside the bladder, instillations. A healthcare provider introduces BCG solution into the bladder through a catheter. Patients usually receive an initial induction course of weekly BCG treatments, followed by maintenance therapy at regular intervals for up to 3 years in some cases. BCG is effective in reducing the risk of recurrence and progression of non-invasive bladder cancer. It can help prevent cancer cells from returning or invading deeper layers of the bladder wall. Resources for bladder cancer patients include the Urology Care Foundation and the Bladder Cancer Advocacy Network, or BCN. For more information, please see Cancer Self-Defense 101, Quick Tips to Help You Survive.